Okay, we're going to talk about endocrine disorders, and we're going to start by looking at the glands where these disorders generate from, and not only that, but what the glands are, the hormones that they produce, and their function. And rather than really going through a laundry list of the disorders and what their manifestations are, I want you to think about what the hormones are and what the hormones do, and think about how that can affect these disorders. So these are really the disorders that we're going to talk about, with the exception of diabetes and PKU. Those aren't really listed here, but these in red are really the disorders that we're going to talk about. And I really like this chart because it really shows you the endocrine glands. So the adrenal gland and the pituitary, really those are the only ones that we're really focusing on. And here are the disorders that kind of stem from those, and the glands and the hormones that really affect those. And treatment for these disorders are really pretty simple. Basically, you're just going to replace the hormone that's missing. So this chart really represents these disorders, and we're just going to kind of walk through these quickly, and then I'll show you some of the manifestations of what these look like. So let's start over here with hypothyroidism, which comes down from the pituitary and affects your thyroid hormone. So if you don't have enough of that, the thyroid, remember, is really responsible for metabolism, which basically affects everything our body does, from food processing to our energy to our movement. And in children, it affects development and cognition. So that's really important. Hypopituitarism, basically, you can see comes from the growth hormone. And so if you don't have enough of that, then you don't grow. Now, a lot of people will call this just growth hormone deficiency, but we're going to talk about hypopituitarism in its whole, because as you can see, the pituitary puts out a whole lot of different hormones, and hypopituitarism can also involve, besides just growth hormone, it can involve the thyroid, and it can involve some of these sex hormones as well. So fertility can also be involved, puberty can be involved in that as well. But primarily when we talk about this, we're going to be most concerned with the growth hormone. Turner syndrome. This is a disorder that does involve some other things that are not hormone related, and we will talk about that, but primarily here we're mostly concerned with the growth hormone. I did overlap it here because it can also involve the thyroid. Klinefelter is kind of the opposite of Turner syndrome. Turner syndrome is involved with females. Klinefelter is with males. So it's kind of the male counterpart to Turner syndrome, and it's involved, there you go. Klinefelter involves basically a lack of testosterone, but because you have a lack of testosterone, you do have an increase in the female hormones of FSH and LH. And then finally, over here we have congenital adrenal hyperplasia. So this one comes from the adrenal gland. What happens with CAH is that, okay, the adrenal gland produces cortisol, which is basically our body's steroids. What happens is when you have cortisol, that stimulates the adrenal gland to produce or to stop production of ACTH. Well, with CAH, your body does not have enough cortisol production, so the body continues to produce ACTH. When that happens, your body loses salt. ACTH causes your body to lose salt. In addition to that, with the overproduction of ACTH, your body will spill over and begin to produce adrenal androgens. Adrenal androgens are secondary sex hormones. So what happens is you have a loss of cortisol, so you don't have enough steroids. Your body loses salt because of the ACTH, and then you have this increased production of these androgens. So what happens is that in females, basically you have virilization. You don't notice it so much in boys, but in girls, what happens is you have these secondary sex characteristics. So these females are born with ambiguous genitalia because their labias they're bigger, their clitorises are bigger, and so these females are born not knowing. You can't really tell, are they female or are they male. Their internal organs are female, but their external organs, you can't really tell. Boys may be born with enlarged organs, but it's not as noticeable in boys as it is in girls. So think about if you have a baby who's born with a salt wasting disorder, what are they going to look like? We're going to talk about that in a minute, but I want you to start thinking about what these babies are going to look like. Okay, these are those main disorders. Now I want you to think about what these kids are going to look like. So I want you to just get an overall picture. First of all, I want you to note that most of these disorders that we're talking about have either spontaneous gene mutations or some kind of chromosomal issue here, just so that you are aware of that. So again, I don't want to go through a long laundry list of symptoms here, but I want you to get a representation of what these kids look like. And really, there's not a lot involved here. These kids are just affected in a couple of ways, really. So we talked about the thyroid, and basically, if your thyroid's not functioning, everything slows down. They're sluggish, they don't feed well, they don't process their food well, they have constipation, they're cold. I think you've talked about thyroid in adult before. They're insensitive to cold, their hair falls out, their hair gets thin, they have dry, brittle nails. Those kind of things. So that's what you want to look at with your thyroid. You can see where that affects them here. They do have delayed bone age and poor muscle tone. But as we talked about, real big thing with kids is they can have intellectual disability or delayed growth. These babies at the newborn screening, they are screened for hypothyroidism because it's very important that they get treated early. As far as hypopituitarism, these babies are born normal height, normal length. But by a year, they will stop growing. And so basically what you see with them, because their growth hormone is affected, they're going to have short stature. Same thing with Turner syndrome, because growth hormone is affected, they will have short stature. Now, Klinefelter is completely the opposite. They will actually be very tall. Now, from a standpoint of musculoskeletal with the growth hormone, so anything that's affected with growth hormone, that does affect bone growth and bone strength. So all of these ones that have growth hormone affected, you do have to pay attention that they will have delayed bone or they will have more porous bone. So osteoporosis and bone ossification is going to be a problem for them. Now, I want to talk to you about Turner syndrome. So Turner syndrome, because of the growth hormone, you've got the short stature, but you also have some other things that are not affected by hormone. So there are some things I want you to be aware of. They do have some features that I want you to know about, like webbed neck, low hairline. They have this low set ears. And what do you know about low set ears? Ears are developed at the same time your kidneys are developed. So anytime you see low set ears, always think about kidneys. So these kids also have some kidney problems. They also have heart problems associated with them. All of those things have nothing to do directly with the endocrine system, but it's just something that's related to their disease process. Now, Klinefelters. So Turner syndrome and Klinefelter, by the way, are all related to X chromosomes. So in Turner syndrome, they have a missing X, and in Klinefelter, they have an extra X chromosome. So these kids have puberty problems and infertility problems. Klinefelter, they're going to have delayed puberty problems, and these boys are going to have decreased hair growth. They're going to have gynecomastia. It's all related to that extra X chromosome. Remember, I told you they're going to have an increase in their FSH and their LH. These boys will get treated with testosterone. But because of that extra X chromosome, they have difficulty with socialization. They have some school difficulties. So you have to deal with some psychosocial issues with the boys. Now, I asked you to think about what is CAH going to look like because of the salt wasting. So this is the big problem with them. They're going to present and may have problems long term with dehydration and shock because of the hyponatremia associated with that salt wasting. And so these kids, this is going to be a big problem with them. So now you all have had respiratory and you all have had cardiac, and I know that you've talked about shock and what that looks like and how you treat that. So when you come to class, I want you to be prepared to talk about how you recognize that, how you recognize shock, what it should look like, and how you treat that. So I hope this gives you a good representation of what these kids look like. We're going to come to class and we're going to look at some examples of some of these kids, what they look like, what kind of questions should you want to ask these kids with these disorders, and what would we want to do for them. So think about what questions you have, and we will go over some of these things. So come to class with some questions, and we'll talk about diabetes and PKU next.